In my practice, chronic illness is a set of symptoms that I see patients presenting with that track back to a number of different underlying environmental root causes and stressful, toxic lifetime events that act as the underlying root causes. I like to think of the uh, chronic illness as being a group of symptoms, particularly that kind of point us in that direction. At the top of that list, we'd say chronic fatigue. Probably second in commonality would be brain fog, which is kind of when people lose the ability to process information and remember things. But we just call it brain fog. Under that would be a whole host of mood disorder symptoms, including sleep disorder. So there can be persistent anxiety, or there can be sadness and depression. At the worst, it can even be suicidality.
Mm,
Um, the next down on the list from that for chronic illness would be a whole host of GI symptoms or intestinal symptoms, which kind of we can clump it together and call it irritable bowel disease. And that's a group of symptoms that would maybe include bloating, nausea, vomiting occasionally, diarrhea, constipation, pain after eating would be the typical things we'd see there. And then behind that would probably be a whole host of pain related symptoms, whether it might be headache pain or joint pain, muscle pain, diffuse body pain. But those are probably the five major areas that we see people coming in with chronic illness, and no two people have exactly the same complex of symptoms. I would say that's a tough question, but probably the chronic denominator is the sum total of all the toxin exposure that our patients have. There's a hierarchy of different toxins. I kind of put mold toxins at the top of that list. Probably the second would be nowadays, I say COVID-19. And then falling in under that would be another host of different environmental toxins, including Lyme and some of the different germs in that category of what we call stealth infections, or some people call them vector borne or tick borne infections, man made chemicals. But I would say overall, it's the sum total of all the different toxins that's kind of the common theme for these patients that we see. I kind of debated between saying that versus just talking about people that, because of their own personal sensitivity, are more sensitive to these various environmental symptoms or exposures. And that tends to be a commonality of my patients too. In other words, people that for various reasons are not sensitive to environmental toxins, they just don't seem to come into my office. They're probably exposed to just as many toxins as everyone else, but they just don't end up causing these symptoms that we went through a minute ago. And that's kind of a complex question. There's obviously multiple things that people should do, but a lot of times I say at the top of the list would be for people to try to learn to do what they can to keep their brain in as much of a place of calm tranquility as possible, because it turns out that all of these different toxins from the environment and what I call toxic life experiences, which a lot of people might just call them stresses, they have a common theme of triggering the brain to perceive that the person is not safe, but in fact in a place of danger. And it turns out that it's that state of danger of the brain, the threat brain, which some people call the autonomic nervous system or the limbic system, that seems to be where these signs and symptoms of illness are actually generating from. And so, a common thing that we can talk to patients about is just trying to learn to keep your body in a state of calm as much as you can control it. Now, because of these exposures, sometimes you can't always help your brain perceive that you're safe. For example, if you're living in a moldy environment, as long as that's going on, you can meditate and pray and think positive thoughts all day long. but your brain still may stay stuck in a place of danger. Always for me, the approach to people with these kinds of problems, and even honestly, just people that come in wanting to optimize their general health, it still starts with a very thorough history. And in that history includes a lot of things, but we focus a lot on onset of symptoms because that gives a lot of indication of what might be the most proximate root cause. Although always these toxins that cumulatively contribute to illness, it's never just one. It's always a sum total. But frequently there might be one that would be the most recent or sometimes a more strong exposure that might act as the straw that breaks the camel's back. But always we take history that includes time of onset, other history of illness as, in early stages of life. We talk about in ongoing exposures where patients spend their time both indoors and outdoors, hobbies that they might have, occupations. We talk about prior evaluations, prior treatments, prior diagnosis that the patients might have received from other practitioners. But history, I think in my mind, probably 80 to 90% of the information that I need to successfully treat an individual can be uh, can be gotten through a very thorough history with the patient. Uh, After that, we do physical examination, which is, believe it or not, not all that extensive. And then there's many times that we'll do various assessments, laboratory assessments, X-ray assessments, stool, urine, those kinds of testing. But all of that is always individualized, and you'd be amazed at how many times we can dramatically help people overcome their symptoms of illness without necessarily having to do a lot of extensive testing.